I've been overweight my entire life. I spent my high school years being the chubby, funny girl.
I lost weight, I gained it back, gained more back. Lost weight, gained more back.
I know that I used to hide behind my white jacket because I could literally hide my weight behind my jacket, but also feel like I was secure and I could tell people how they needed to live their life. But for my people and for the people out there who suffer with weight, you really need to put it out on the table.
Those that suffer from morbid obesity have a life-threatening disease. It is not a moral shortcoming. It is not a decision. Who would decide to have this disease?
There is such a stigma about being obese in this country that we don't have the voice of other disease state organizations.
The lack of hearing from the obese patient themselves or somebody who spoke for them was a large void. Because we'd sit down with a congressional leader at a state level or sit down with somebody from a health plan, and they'd look at you and say, well, we're not hearing anything.
This disease has no discrimination. It affects people rich or poor, every ethnic background, male and female.
It's a matter of understanding that this is a disease process, but just like you have cardiac disease, but these patients wear their disease on the outside. They can't hide it from you. Our patients tend not to stand up for themselves in a way that, quite frankly, they should.
I will never forget, very early in my career, we had a support group and we talked about what comorbidities people no longer suffered from. And there was a gentleman to my right, he was one of the last to speak, and he said, you know, I had hypertension, diabetes, and sleep apnea, but the worst comorbid condition I had was loneliness.
And every great cause, every great crusade, every injustice that gets taken on, really the pivotal moment is when a person or a group of people find their voice.
The Obesity Action Coalition plays a critical role in driving access for the morbidly obese patient. And now that they have a voice, they can be heard, their issues can be addressed.
I had my surgery 10 years ago. At the time, of course, I was morbidly obese. And when I first heard about the Obesity Action Coalition, and that there was going to be an organization that would advocate, speak loudly to legislators, to corporations, to the public, I said I had to be a part of that.
The great thing about post-bariatric surgery patients is they have those memories, because the weight loss does happen quickly compared to most folks who use other weight loss interventions. And the fact that it does happen quickly, don't lose that memory, and they're willing to step up for that person who's sitting next to them. Some of our greatest advocates are people who are post-surgery patients.
One of the most important initiatives that the OAC is currently involved in is helping to shape what healthcare reform is really going to look like. Working to make sure that access to care for morbidly obese people is in there. Because if you don't have a voice, that is not necessarily going to happen.
I think the OAC has really made it easy to learn who your representatives are and how to reach them. And I think that our patients that have done that and actually got correspondences back have been amazed. And the fact is that lawmakers really do want to listen, and they do want to hear from their constituents. And making your case and really humanizing it to lawmakers can make all the difference in the world.
If you look at the statistics, major employers covering bariatric surgery has increased, I think, about 12%. And so I think we've started to make a big difference in the fight.
It doesn't matter whether it's a big issue on the federal level or an issue affecting the obese at the state level or even on the city level. If it's an unfair treatment, then the Obesity Action Coalition, they're right in the middle of it. They are fighting for the rights of the obese.
Joe Naglaski, the CEO, sat down with Michelle Obama's chief of staff to discuss strategy when it comes to childhood obesity. That door would not have been open to us 4 years ago, and it begins to speak to the good work that the OAC is doing.
Children struggle just as much as adults do when it comes to accessing the treatment of obesity. The fact is that most parents can't take their child to the doctor and that doctor's visit be covered if it deals with weight.
The Obesity Action Coalition organized the Walk on the Capitol, and there were thousands and thousands of people who are walking on the mall right in front of the Capitol, showing their support. And it sent a message to Congress that we're not going away, that we deserve this. We deserve the access to care, the help that we should be getting, and we have numbers behind us.
But it comes down to having a voice and having the OAC being recognized as that voice, and they've done a great job.
This voice is building momentum. We won't get the momentum without membership. I think sometimes people don't realize that their membership counts.
Together, we can help drive better patient access, but we need it around one voice.
The power of driving connectivity around the world, that's what's going to cause the change.
The reality is, in order to drive change in this country, is you need numbers. And that's why we encourage everyone to join the OAC.